And what were you in the military? What rank were you?
No, I was a civilian. So
Civilian.
I
Oh,
was in the,
civilian. Oh,
yeah, as a
really?
civilian working in the military.
Yeah, right. So you had to salute everyone.
Yeah, that's right. Yeah, that's right. It was pretty cool because I mean, obviously you're a civilian and you're working with all these ranks of doctors, and it was kind of cool of
Yeah,
knowing
right.
that part of the
Yeah, right.
culture. Yeah.
Mhm. Hello and welcome to Inside the Shoulder. I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane, and today I have the great pleasure of talking with one of my ex-fellows and now colleague, Roberto Pareyon, a shoulder surgeon working in Mexico. Welcome, Roberto.
Thank you, Ken, for the invitation. I'm really excited to see you, obviously, and to be part of your podcast. I'm really
Yeah,
excited.
yeah. So I saw you in the Netherlands only like a month ago, 6 weeks ago or something. Roberto flew over. I was talking at a conference in Rotterdam, and we did surgery with one of my other old fellows, Freck Holman. And so the three of us were in theatre with Freck in his theatre doing a day of operating, which was such a great reunion, such a good thing to do. Freck did some really cool operations, didn't he?
Yeah, it was really amazing to be in the other side of the pit stop now,
Yeah,
to operate with you as a
yeah.
fellow shoulder surgeon. It was really amazing.
As a colleague, yeah, so good.
Yeah, but I actually still have learned some tips and tricks from you, which that's very good. Also
Yeah.
in the arthroscopy large, where you're just a master on that, and yeah, it was really amazing to see Freck as well, like
Yeah,
as a shoulder
isn't it
surgeon. It
great to
was
see
really good.
Freck actually working as a consultant surgeon and doing those
Yeah, it
big
was good.
operations, the complicated operations we saw him do.
Was
So,
really proud.
Roberto, uh, a lot of people, think about, what doctors have to go through or don't think about it and don't know. You grew up in Mexico. Your native language is Spanish. Tell us a little bit about your formative years and what got you interested in doing medicine and becoming an orthopedic surgeon.
Yeah, it's really good. Like, it's a little bit different than in Australia. Here in Mexico, we do 6 years for medicine. I want to be a doctor since I was since I was a little kid. Like, I couldn't match with other type of work. I was really happy to be a doctor, and then I always be a sport guy. I have been in sports since I was a child as well, and I matched my two passions between medicine and sports. With orthopedics because I also like surgery, not the analyzing part of the sport, just like the surgery, and that's why I elect orthopedics as my specialty, and then I just fall in love with the shoulder. Like I thought I gonna be a sports guy, but no, I just fall in love with shoulders. I mean, there's a lot of sports part in the shoulders, obviously, but the whole shoulder now that it has been evolving, I think is one of the most evolving subspecialties, the shoulder, and maybe foot and ankle in orthopedics. I mean, it's just growing and growing, and yeah, I mean, here in Mexico, where you have 6 years to be a doctor, and then you do a national test, which is a big bottleneck. Cut for all the doctors who wants to be to do a special training. So just when I took the exam, when I sit that exam, just 10% of the doctors which actually take it can have a spot in the specialty. So that's a big bottleneck.
So you all take the same exam, irrespective of what specialty you want to do.
Right,
So
right.
physicians, people that want to be a physician or a surgeon, they take the same exam, do they?
It's the same exam. Yeah, exactly the
Really?
same exam. Yeah,
What does it ask you?
I mean, it's general medicine, especially pediatrics,
Hmm.
especially OB-GYN, and trauma, and like not trauma, like more like ER type of
Hmm.
stuff. It's just the same exact question for everybody. And I don't know if orthopedics have 10 spots, then the best 10 grades go in, and
Hmm.
that's the way it goes.
And when do you sit that exam? When can you when what's the earliest time you can sit that exam?
So you have already finished your intern year, and here in Mexico, you need to do one full year of social service. Every doctor needs to do 1 year of social service.
So what's that? What's social service?
So that is like 1 year that you need to go to another town, a small town, or you can do it research. I mean, there's a lot of stuff that you can grow with now. You can do it in your school, but the traditional part of it is as you as a new graduated doctor, you go to a small city or small town in other part of Mexico, and you just help that community in terms of I mean, helping and do like consults and whatever for 1 full year.
And so you're working as a doctor at that time?
Yes. So you're working as a doctor.
Yeah,
Yeah.
right. Right.
Yeah. Yeah.
Where did you do that?
So I did my part with in the military actually,
Hmm.
like doing in the military service in Mexico as a civilian. I was doing a lot of consultation for the families of the military people.
Uh-huh.
So yeah, I work in a military hospital, which was in Mexico City, inside Mexico City, which that's good because I didn't need to leave the city. But yeah,
Right.
I mean, I work in that military part. Yeah.
Uh-huh. So, what were you in the military? What rank were you?
No, I was a civilian. So
Civilian.
I
Oh,
was in the
civilian. Oh,
yeah, as a
really?
civilian working in the military.
Yeah, right.
Yes.
So
Yeah,
you had to
it
salute
was pretty
everyone.
cool. Yeah, that's right. Yeah, that's right. It was pretty cool because I mean, obviously you're a civilian and you're working with all these ranks of doctors, and it was kind of cool of
Yeah,
knowing
right.
that part of the
Yeah, right.
culture. Yeah,
Hmm. So after that year, so what you do, your
you sit
intern
the exam.
year, then a year of social service,
Yes,
and then after
uh,
that, what did you do?
and you sit the exam, so
How
you
did you go in
can
the
directly.
exam? I assume
Uh,
you were in the top 10%.
yeah, it was pretty good. It was
I mean,
pretty
that's a
good.
pretty big cut, isn't it? 90% don't make the cut.
Don't make the cut.
It
Yeah,
must be
it's crazy.
pretty confronting going to that exam knowing those figures.
Yeah, nowadays it's better. Now it's I think the rate it's now like 35% because there's
Hmm.
more spots. But still, I mean, there's still a lot of people that need to sit the exam the following year and then the following year and then the following year. There's people that can sit the exam forever and it's yearly. So if you don't pass the exam in that year, it's just a full year that you need to study again and prepare for it.
So life's on hold until you get through that exam.
Yeah, it's crazy. I mean, it's crazy. And then you get to the program. So I know that in Australia it's quite similar in terms of I mean I know that in Australia you took a lot of time to get to the program. You need to be a PHO and then a resident, and then you need to get your name by yourself and have some like courses, right? And you can took 5 to 7 years.
So what I went through, and it's gone back to this very similar system, you had to sit an exam before you could be appointed to a surgical training program. But the exam
Okay.
wasn't a general exam. The exam was specific for surgery and was basic science related to surgery, was what it wasn't a clinical exam. So it was
Okay.
physiology and anatomy and pathology. And the pass rate for that exam when I sat it was 11%. And if you didn't pass it the first time, your chance of passing again dropped to like 5%. And then beyond
Wow.
that, 2% for the third time through. These are the figures. So, and, these are, everyone's, it's competitive to get into medicine in the first place. And then, to select out and decide you're going to do surgery, which is a fairly confronting career path. These people were driven, motivated people. And yet the pass rate was very similar. 11% was the pass rate. So it was
Wow.
super confronting. But you had to
Yeah.
do that before you could then apply for anything. And you could do that from after your intern year. I think you could do it halfway through second year.
Yeah.
I
Okay.
sat halfway
Well,
through beginning of third year. I think is when I sat it.
it's good to have that pass exam like at the beginning. That's really good. Yeah, I know Australia is also really tough to go to a program, and I think it's good.
So then it was what? How long in the orthopedic training program then? How long is your
So,
program?
so it's 4 years.
Yeah, right. And do you have an exit exam?
So you need to be like a board exam to. It depends on your medical license. It depends on your
Hmm.
board exam, and after the board exam, you have your medical license for practicing orthopedics.
Right. So you don't get your license to practice as an orthopedic surgeon unless you pass the board exam.
That's right. Yeah.
And that board exam is in orthopedics then, as general
Yes,
orthopedics.
yes.
Yep.
Yes, yes.
Yeah.
General orthopedics, a lot of pediatrics and tumors and that stuff, which
Yeah.
is
Right.
good. Yeah.
So, what? So you come out with a general training in orthopedics, which is then the fellowship thing. For people who don't know about fellowships, it's a voluntary thing to do. It's a very well accepted pathway, and it generally is a 12 months, although it can be different times, and it's taken voluntarily. And someone like Roberto then decides they want to do shoulder surgery, which is very subspecialized compared when you come from a general background of orthopedics, and you decided to come to Australia. What was that like? How did that happen?
It was really good. At the beginning of my second year as resident, I start watching that shoulder surgery is really complex. It's really tough. It wasn't very dominated for the surgeons that I was in my training, or maybe one or two that really were skilled in shoulder. And I was really keen on how to operate on this. And I was like, from my second year, I was like, okay, I really want to do this thing good. And at that time, even the reverse shoulder arthroplasty, it wasn't a thing here in Mexico. I started like just watching videos and watching all these congresses and the shoulder boom that actually took place a few years ago. And I started looking for all these papers, and I just remember watching one of your paper about lat dorsal transfer, like
Yeah, right.
all arthroscopic lat
Yeah.
dorsal transfer, and I was like, what? Like, I mean, nobody was doing lat dorsis, and then this guy is doing arthroscopic lat dorsis. It was like, what? And also a lot of the registry of the Australia, like
Hmm.
every it's worldwide really good accepted, or it's really like have a really, I don't know, like it's very respected, right? Like the
Hmm.
joint registry that you have in Australia, and I
Yeah.
have seen a lot of talks about it. And I have seen also one in that time that Ashish gave a talk as well
Hmm.
of the registry. And I start like looking for you guys, like okay, this is a place where I want to go. For us, going to the States, which actually could be easier because it's our country, our neighbor country, but you need to do the steps and a lot of exams to go there. And I really wouldn't like to go to the US. And I
Hmm.
started looking for other places, and I watched, I was second year, I look at all these papers of these techniques. And that's why I end up in your fellowship. I actually Googled it in the ISACO's website,
Hmm.
and I saw you were there, and I just applied.
Yeah.
And yeah, I mean, it was I think it's a little bit of luck actually, because one of your fellows, actually in my story, one of your fellows actually canceled like really near to the date. I was year three, so I wasn't finished. And then I remember that Ashish, as ex fellow of La Fosse and one of my partners now, that was my professor, Ashish put a text there, which we were looking for a fellow, and I already
Hmm.
applied to your program.
Hmm.
And he told me like, "Is this the program that you're applying with Ken and Ashish?" And I was, yes. Yes, I
Hmm.
want to be there. And I sent again my papers, and then you guys come quickly with me because you have your IELTS and your exam, your English exam, and you have. Are you already an orthopedic surgeon? And I
Yeah.
was no and no, but I want to be there. And yeah, you gave me an interview, and you select me, and I was really happy that at my third year I already had my fellowship. And yeah, I mean, I was really excited, and I think it was the decision professionally that I can do.
Oh, I remember your application coming through, and I remember distinctly, because I get a lot of applications for the fellowship, and what really set you apart was that passion. You had this dream of becoming a shoulder surgeon, that passion to do it, and that really shone out in your application. And it was just so there's just and your credentials and your academic achievements were fantastic, and so it was a no brainer to invite you to come and work with us for the year. It was and
No, thank you, Ken,
it's
for
been
selecting me.
fantastic. Yeah.
It was really good, and I will always be grateful for that opportunity and for opening my mind. I everything I do now, I actually learn it in Brisbane, so that's really good.
But you talk about that boom in shoulder surgery. It really was a boom, wasn't it? Because I lived through that. I was a general orthopedic surgeon, and I knew that I wanted to specialize further. And shoulders was just where everything was opening up. This is some years back, and I went through that boom. And that boom, for people who don't know, in shoulder surgery was going from open say the classic, the type operation is the open rotator cuff repair, which is now an arthroscopic rotator cuff repair. I haven't done an open rotator cuff repair in probably 10, 15 years now. And I was part of that boom, and what happened was that the technology got to the point where it could let us do these operations very successfully as arthroscopic procedures. And it really was a boom. And now we're doing arthroscopic lattice days. All the stabilizations are done arthroscopically. And the technology caught up to shoulder surgery. And there'd been that boom for knee surgery, but that was in the 1990s. And shoulder surgery, it is different, isn't it? I remember doing arthroscopic ACL replacements or reconstructions when I was in training, but I can tell you it took me years to develop the skills to do the arthroscopic rotator cuff repairs. It was another level again. It really was.
That's it.
And I think you went through it and saw that, and you've got it too now, haven't you?
Yeah, totally. Like even in my training, people were opening a lot of the cuffs, doing all the arthroscopic part for the knees, but they were opening the cuffs, and I really was keen to learn how to operate like all the arthroscopic and learning the shoulders. I just remember a line you gave us to us that the sport guy treat laboratories and the shoulder guy treats instability.
Well, a little bit, yeah. Yeah, if there's a labral tear there, we're going to fix it, but they're treating
Right.
the underlying instability of the shoulder, and that
Understanding the
that
shoulder.
may not
Yeah.
just be a labral tear. Um, and what's happening now? What's happening with your career now? Where are you? You're a consultant working in a hospital. You're doing shoulder surgery. Tell me a bit about that.
So yeah, when I came back, I have the opportunity to join to a group. We are a young group back in Mexico City. We are in the biggest hospital, in the biggest private hospital of Mexico City,
Which
which
hospital
is
is that?
really well known. It's ABC Center. It's American British Code Ray. So it's a hospital which actually was made it for the British community, and then it's a private hospital, only private hospital, and yeah, I mean it has two hospitals in Mexico City, and it's really big. It's I think it's one of the best renewed names hospitals back here in Mexico. I also work in other hospital, which is Angeles, which is another big brand here in Mexico. So it's the two biggest hospitals in type of private practice we are on it. This group of young guys, each one have one subspecialty. So we have the knee guys, the sports guys, the trauma guy, the pediatrics guy, the replacement guy for knees and hips, and we are two that would do all the shoulders. My partner, which is Javier, which you have met also in Netherlands, he trained with Lafosse, and yeah, and he invited me to be part of this program, and we are really happy because when I saw you guys like that you only do shoulders, and I actually remember when you told me when you decide to do all the shoulders. That's something that I in my fellowship or before my fellowship, I think it was going to be hard, because as a young surgeon it's really difficult to do just one joint, but actually it comes really good. And I just remember you telling me, just commit to shoulders, people gonna see that you're gonna good at it, and people gonna remember your name when they have a shoulder patient, and that's what actually is happening. And I really grateful for you to giving me that tip, because yeah, I mean it's the difference.
It's fairly committing, wasn't it?
Yes.
I
Yes.
remember when I went through it, and I had some of my mates who are knee surgeons, and I talked about it quite a lot for a couple of years before I did it, and because you know I you know I was in private practice, and I had to, because I was doing hand surgery as well, just say no more hands, and my practice was really quiet for a while. It was really confronting, but I just stayed the course and stayed with it. And because you're just doing the one thing, you become good at that, and you get a lot of knowledge. You also see the interesting and the difficult, the rare cases, and you become much more familiar about how to look after those patients. And that, so you build a body of skill and knowledge that is very helpful to people. And yeah, so I remember it was super confronting, but it was the best decision I ever made. It was fantastic, because it did go down that pathway of developing a really interesting and worthwhile and fulfilling career, rather than what I had been experienced, which I wasn't, it being more general, wasn't so fulfilled with. Yes, I'm glad you did. I'm glad you actually went down that pathway, and I'm glad you're seeing it.
Totally agree. And I was also have the luck to be in this group, which is it's a group that before I came, it's actually was a big group.
Yeah.
I think it's a group as an orthopedic. I mean, talking about the hospital, I think we are the biggest hospital now. Sorry, the biggest group that are actually working orthopedics in that hospital in Mexico City. Yeah, so we're I'm very happy that I also l- being a part that I have a support group would actually say, okay, you're gonna be the shoulder guy, and that's actually what I want to do because you already told me. I was like, I was really keen to not doing knees or doing hips, and I'm really happy now where my practice is, and I mean, yeah.
Well, you get a level of expertise which has value, and people put value in that level of expertise that you develop. It's a very real thing that you actually uh, that grows with you as you go down that pathway. That is valuable to your patients.
Yeah, 100%. And people start noticing as well. Like it's culturally changing a little bit. Like the orthopod or the orthopedic surgeon that it's doing all these different joints. I think it's going. I think there is less and less of that, and I think as people are trying to subspecialize in something and really know how to do one joint really good because every joint I think is a world and it's a lot of things to learn and it's really
Yeah,
difficult to be quite updated in everything.
yeah. Now you're going down. You were telling me you're going down the pathway of leadership in the medical community. What's happening there? Tell us.
So I'm really happy today. I actually saw you when I was there. Like you were the AOA secretary in that time. Now you're in the site. Like I see how busy your practice can be and how you can lean the family part with with the leadership part and the with the practice clinician part. And I think okay, this can be done.
Oh
So
yeah.
yeah, I mean it's just matter of organizing your time, but now there's there's a SLAUC. The SLAUC is the Shoulder and Elbow Latin American committee, which has been forever, and it's really a really famous association here in this part of the world. And there was not there was a big gap between maybe the more experienced shoulder guys and the new generation of shoulder guys. So what we have learning about our what we have what talking that we gonna or we already made a junior committee, which that means that if you're in your in your 5 years of practice after your fellowship, after your shoulder and elbow fellowship needs to be a shoulder and elbow, you can be part of this junior committee and you're gonna have some exposure in your in the meetings and you're gonna have some research grants and research opportunities and you're going to be have the opportunity to to change ideas and to know your colleagues all around the continent. And this was an idea of my very good friend Juan David Lacouture, which is a Colombian guy who actually was the first guy who opened this with me. And he was the president 1 year or the last year, and the SLAUB meeting was just 1 month ago. It was like maybe 3 weeks after we were in Netherlands. It was in
Hmm.
Cartagena, Colombia, and actually I took the presidency this year, which is really good.
Congratulations.
Yeah, thank you, Ken. It was a it's a new committee. It's I think we're becoming a little bit more powerful now with a lot of young surgeons that try to talk about what they are doing or where they train and it's really good because you talk with people that were training in in Europe or people were training in Asia or people were training in the States or people were training in Latam as well and you are like connecting from your early years of practice, which I think it's awesome. I know you have more you have more experience in that and what can you tell us about it?
Look, it's a really rewarding pathway to go down these leadership pathways, and you have to do it because it's another skill you have to learn, and it takes time. But it helps grow you as a doctor, as a professional. It really does. So I encourage you to do it. It's always rewarding. Yeah, it's very time consuming. Um, it and it's you giving your time to it, but you can manage it. Just have to juggle everything and fit it. It fits in.
Yeah, 100%.
Yeah, you end up. I think you're probably getting the experience most nights during the week. You're on link ups doing Zoom calls and so on.
Yeah, that's right. So, I mean, yeah, it's time consuming, but it's also rewarding. I don't know if the patients know it a lot or if the patient really care about it. I
No,
don't
I
think,
don't think
but
so. No.
I don't think so as well. But
Well, I do
it's
think
good.
people like to know what you're doing, that you are actually doing something, because it's a different pathway, a different walk of life, and this is one of the things I encourage all of you guys to come and work with me to actually put up on social media what you're doing, particularly on LinkedIn, and because I think it's helpful for all doctors to do that, particularly young doctors coming through, because uh, it changes the cultural perception of doctors for people to see of what we're actually doing to go down this pathway and what it involves and the commitment.
100%, 100%. And also you can change ideas or what is people doing in other parts of the world, and
Yeah.
in not other part of the world, like maybe Europe or US or Australia, like people in your same area, and you can share the struggles and share solutions. I think it's really good. And let's see how this year treat us.
So what's the membership of this society? It's all of the South American countries, is it?
Yeah, it's the Latin America countries from Mexico to Argentina and Chile.
Yeah, right. So do you have any of the South American countries that aren't represented in your society?
No,
Uh,
every
uh,
single country.
yeah, right.
It's. I mean, there were two countries that we're now 15 countries. There were
Yeah.
two countries that it just joined, like El Salvador, and I think Dominican Republic has
Oh,
just joined.
Dominican Republic,
Yeah,
of course,
which is
because it's,
good.
it's Spanish as well.
That's right. That's right.
Yeah.
So yeah, I mean, we're still growing. It's the union between of every shoulder society of each country. So I mean, it's a union of all these
Hmm.
societies, which is good. I mean, and shoulder is start it's start to be a thing in this part of the world, and I'm really happy.
Yeah. So where to now? What's the future hold for you, Roberto?
So the future now is still growing my practice. Obviously, I'm 2 years now from my fellowship. That has been really quick. I'm just remember like yesterday I was in Breezy, just enjoying the beautiful city that you live in, and now I have 2 years now. I'm really happy to start growing my practice as only shoulder surgeon, which actually I'm very happy that it's just growing that way. I'm still in this group. Actually, we have bigger rooms now in this hospital because the hospital wants us to stay, and they gave us bigger rooms, and we're very happy as well because we are growing as a group as well, not just in the shoulder area, just as the knee guys are just pushing as well. Like everybody's pushing. I want to start doing more research because I know, Ken, you have this amazing. You have a wall of all the papers that has been published as the ASRI, and you have just really killed it on that, and you have a lot of help. And I just trying to implement all that thing that I actually learned from your rooms and learn from your research culture, trying to bring it to this part of the world that we don't have that culture. So we're trying to build it so we can start publishing our results as well.
Yeah.
And yeah, I mean that I think it's important. It makes you a better surgeon. And yeah, I mean, just step by step. I can when I came from fellowship, I believed that I will could change everything in just 2 weeks, but it's not like that. But yeah, I mean, just step by step.
Yeah, look, I remember setting up the research side of my practice, and I saw role models, the orthopedic surgeons I looked up to, getting up and presenting papers at the meetings, and I really wanted to do that. And then, how do you do that? And what I started, I employed a research assistant and started following my patients, and then started talking about what my experiences were, and that's the pathway. And you know, it's not cheap. I think some people forget that that's all got to be funded and everything, but it's so rewarding to do it, to go down that pathway and actually just start doing it. And then you develop fantastic relationships with researchers down at the universities, professors of right now at QUT of engineering, and it opens up a different side to what you're doing, which is so rewarding and so wonderful to go down that pathway.
Yeah, 100%.
You feel like you're contributing to knowledge.
And also, like, I just remember that you present your 100 Large from your experience. Like, I
Yeah,
mean, nobody got that numbers.
we're just publishing 300.
300. Yeah, that's
Yeah,
right. So
yeah.
it's crazy. Like, you have all these follow up of that papers and of all that patients, and it's really good because then you are setting the tone of how to do it, and then you can really learn. Okay, this is the arthroscopic allergy. Like, I don't think there's a 300 patient series 2 year follow up with all the data that you have in, and we learn a lot. Like, I actually we learn. It's really good, and I want to do that as well. So that's a future for me. I want to start implementing research in my practice.
And in terms of your patients and the operations you're developing, where are you going there?
That's really good because actually we were the first group here in the hospital which bring the PSI, which actually I learned for you because for
Yeah.
all your patients you are doing that special surgery for that patient.
So for the people listening, PSI is patient-specific instrumentation, and what it is in shoulders is very important that the shoulder prosthesis is positioned in the correct position. That makes sense, I know, but for when I came through, there was none of this available. So you do the shoulder replacement and just eyeball it that you're getting in the right place, and that does okay. But there is now computer planning software which you can set the position of the prosthesis and then work out optimum range of motion for that particular patient, taking into account their what their shoulder's doing, how worn out it is and what the particular problems if it is the rotator cuffs there. And then how do you get that actual position that you've carefully positioned with the computer software? Well, you can get a 3D printed guide which will click onto the shoulder at the time of surgery and get you that exact position. Rather than eyeballing it or guessing it, we get that position. And for me, that has made the shoulder surgery so much reliable. I can tell the patient that this is what I expect you to get post-op. And we normally, it is just so much more reliable, the outcome that I get for my patients. And you're now going down that pathway as well. And that's a new thing in your part of the world, isn't it?
That's right. We didn't have it. Like, we didn't have it, and now we have it.
And that's for anatomic shoulder replacements and reverse.
That's right.
You're doing mainly reverse.
I'm doing mainly reverse. I'm doing mainly reverse for this. Yeah, but yeah, I mean, we're very happy because we have it now, and actually, we were the first one to start doing it here in the hospital. There's a lot
Hmm.
of Mexican really good shoulder surgeons as well that they were like doing by themselves and whatever. But and I think it's a beginning. And there's this boom here in Mexico as well. So
Yeah, I think shoulder arthroplasty has been a big boom. When a few years back when I was doing a lot of arthroscopic work, and I knew that I wanted to do a lot of shoulder replacement surgery for patients because I was seeing a lot of them. And I went overseas and I visited, I think six orthopedic surgeons in the United States, all of them doing more than 400 or 500 shoulder replacements per year, which is just at the time was mind blowing to me. There was no in Australia approaching that number. And then similarly in France, similar surgeons doing that. And also I went to visit one of the surgeons in Japan as well. And that changed my perception of how to do shoulder replacement surgery and really set me up for this pathway and going down this pathway of uh, making shoulder replacements work really well for everyone. And that's changed. The perception. I still have patients coming in. They've been told by their physio and their GPs, "Don't get your shoulder replacements. They most of the time they don't work. They're terrible." And that's not my experience anymore. And it is this pathway of being so particular about the surgery for patients and the PSI. These patient guides, 3D printed guides we get. How long does it take you to get a PSI guide now?
So that's a problem because we are maybe between 6 to 8 weeks, which is not.
Yeah.
It's a lot. We're working on having it a little bit earlier. We're talking with all these all the the prosthesis what we work and
Mhm.
but in the industry. But yeah,
And what about computer navigation? Because that's the other option that I have now. So to people listening, what you do there is have a CT scan, and that's registered to the patient intraoperatively by the fixation of uh, uh, a, a device onto the shoulder. We put it onto the coracoid process. It's screwed onto the coracoid process, and the computer software and the setup in theatre can work out where that is, and then you register the CT scan to the shoulder with that as a baseline reference point. And then on screens, you can see on computer screens, you can see exactly where you are and where you're aiming the prosthesis at the time of the surgery, which is pretty cool. Do you have that available? Because now that's another step for me, which has been really good.
So right now we don't have it, but I've
Hmm.
been told that we're gonna have it maybe at the beginning of next year. So I actually been very happy
Wow.
to start doing that, and maybe I will give you a call to give me your tip and tricks on that, because it's
Yeah.
also a new thing for us. But yeah, I mean, we're really excited because there's all this new technology that it's around the shoulder that actually I think it gonna make us really sharp on putting the implants where it needs to be.
Yeah, I think you describe it well. It's another boom in shoulder surgery, isn't it?
Yes,
Yeah.
100%. And yeah, I'm very excited to be in this part, like right now in this moment of time that it's just growing and growing and growing. It's really excited to be shoulder surgeon.
So, just finishing up, what advice would you give to someone listening who is going down that pathway of being a doctor, and they'd love to do orthopedic surgery? Yeah, and go down. They're not in training. They're finishing medical school or starting out as or a junior doctor, and think of that very confronting thing of going down the pathway of orthopedic surgery, which is so difficult to get into. Got any advice for them?
Yeah, I mean, we train a lot with these young doctors here, and we have it in our rooms. And I always tell them that, I mean, if you're really interested in to be in a part of to be an orthopedic surgeon, you need to chase it down. Like, I mean, you need to become obsessed with the exam, and you need to become obsessed in one moment of your time to just sit that exam and just achieve your goals. And when you're in, then you're gonna be very happy, you're gonna be trained, you're gonna have a very big specialty that is orthopedics, and you're gonna have to and you're gonna be able to choose on what you really like, and I'm 100% sure that you're gonna find what you really like. And after that, just become obsessed on being very good on that.
Yeah.
And go train, have mentors. I think to have mentors is really important. It changed my practice, it changed my professional life to have a mentor like you can, because then it expands your way of thinking, your way of doing things, your way to, and and for me to become from Mexico, to come from Mexico to Australia and then come back, then I'm very happy because you are now helping your country, helping your people,
Mm.
helping that thing. And I think to have a mentor is really important, and I think to become obsessed on that, you need to be obsessed on becoming that.
I agree with you completely. Have that dream and chase it down. Become obsessed. I think that's fair. I 100% agree with you, Roberto. Mate, it's been wonderful talking to you. I can't wait to catch up again with you, and yeah, maybe see you next year at a wedding.
Yeah, yeah, that's gonna be really excited. Congratulations
Yeah,
for that, Ken. I'm
thank you.
really excited to be there. And
All right,
yeah, hope you to catch up.
ciao. Bye, Roberto.
Bye.
Thank you.
Bye, Ken.
If you enjoyed our discussion today, please think of rating it on Apple Podcast or Spotify or wherever you get your podcast from. Thank you for listening, and goodbye for now.